My name is Liza Merrill, and I am the Empowerment and Advocacy Specialist at Asian Pacific Community in Action. The community itself. I've always been passionate about the Chamorro community is dear to my heart. And as I've worked with APCA, I've been exposed to so many other communities, Vietnamese, Korean, Chinese, the emerging communities such as the Burmese, Nepali. It's been wonderful meeting all these different people. And I always thought I was diverse because I'm from Guam, I live in Arizona. I had no idea of these other communities until I started working at APCA, and I realized, oh my gosh, I've had my blinders on. I've been out here in over 30 years, and little did I know that we had such different communities and their needs. It was like eye-opening for me. I love APCA. My husband always says, "Don't say you love APCA because people don't really love their jobs." And I'm like, but I can't help it but say, and with our mission and our vision changing in regards to, we do direct services like we've always done, like hepatitis B and health fairs, but now the empowerment piece and the advocacy piece and helping the different communities that have been living there have a voice. They've always had a voice, but helping them make their voices louder and combining them and collaborating, it's just real exciting for me. And I can't wait to see what's in store, in the coming year. The health forum has always given us support. And even when we were having the transition between our past ED and our present ED, they were there along the way, holding our hand. I'm sorry. There were times where I felt, that people were coming up to us and saying, "Oh, APCA's, in trouble. APCA's this, APCA's that," and I felt like I was fending off, the negativity, and then. And I'm so sorry, I'm such a baby, but the health forum was there the entire time, holding our hand and reassuring us that it's okay, you're going to be okay, and I knew, that they were right, but, they gave us and gave me the support that I needed to be positive, moving forward. And then I look at it now and I'm like, here we are today, and it's such an exciting, adventure. But for a while, I have to say, they were the support that I needed, the so-called rainbow in the storm kind of thing. So, and I can't be grateful enough for them. And I hope, APCA in my heart, in my communities, in my heart. And, I just get so emotional about it because it's really, important in what I do and what I believe in, and I know I couldn't, for all the learning that for all the experience that I have in the last 4 years that I've worked at APCA and the guidance, I really couldn't have done it without the health forum's, support and belief in me, and because there were times where I didn't even know what I was doing, and I didn't even know who I was, and they're like, "Liza, you're a community organizer," and I would say, "Oh, I'm just this, I'm just a person." And he goes, "No, you're not, you're so much more than that." And then Rox goes, "And don't you ever say you're not, you're not this, you're not that. Don't ever believe that, because, we believe in you." And I guess with those words I've never forgotten. It was exhausting, it was sometimes frustrating, but we never gave up. And the reason why was not for the dollars or the accolades, it was because it was a real life person we were dealing with. And there's so many sad stories. So I'm sorry, but when you have people in tears and they're ill, there are people dying or having, terminal illnesses, and not going to the doctor because they had no money, it really breaks your heart. And you want to do the best you can to help them. And in the end, when you're helping them and they're just so happy and, smiles are from ear to ear, it makes all that time that you spent and really worth it. Like they say, it's priceless. It's true. It's priceless. And so any person that says anything about the Affordable Care Act that's against it, I have so many words for them, because the people that we help, and it's, there are so many people that we help, words can't express, the appreciation they have, and I just know too that if we didn't help them, no one would have. They did so many things, whether it's the finding support money, giving us, mini grants, the technical assistance in regards to supplying us with the training, the resources, the guidance. It's just endless. I mean, like I said, they were the big brother, big sister that we looked up to. And we're like, help, and and they were there. So Health Forum, I just, they're in my heart forever. I always say, move the needle. Like they say, move the needle. We did it last year. We're going to continue to it this year during the ACA, and not only that, but also with the PSE, the Policy, Systems, and Environmental Changes. And I learned that from the Health Forum, we are going to make sure that our communities, all our communities, the emerging communities, our Asian American, Native Hawaiian, Pacific Island communities are not forgotten when it comes to legislation, when it comes to healthcare, when it comes to anything holistically for a person overall. We are going to make sure that we are not forgotten or not left out. There's so many wishes. I wish for the Asian American, Native Hawaiian, Pacific Island communities that not one person will be without the support and help that they need. That regardless of their wants or needs, their difficulties, that they find the support. The support, whether it's financial, whether it's emotional, mental, physical, that they find the support within our communities and in APCA, and then they find the guidance, or they know where to go, that they're not lost, and that they're not alone. And I don't want ever anyone in any of those communities to feel that they're alone. I want them to know that we have angels out there, whether it's the Health Forum, whether it's APCA, whether it's their ministers, their pastors, their family, that they are not alone, and they will never be alone. And that we are, and if they can't find us, we will find them. So we will be that light that they need.